So we have a very easy thing, the irritable bowel syndrome. We're continuing the GI tract. So irritable bowel syndrome can have cystitis, defecation, or the improved pain. Okay, same like that of so irritable bowel syndrome. Pain also, if there is pain, then also use TCA if hyoscine inadequate. Stress, SSRI, avoid inconsolable fibers. Okay, and diarrhea for loperamide, Vicilium can be given for second line again. Cholestyramine. Hyoscine is hyoscyamine is a muscarinic antagonist. Relax smooth muscles, decrease cramp. So if there are cramps, then we can give hyoscyamine, Vicilium, soluble fibers, malignant chronic pancreatitis, and inflammatory bowel disease. You need to roll out these three things. Okay, so irritable bowel syndrome greater than 65 years, new onset bowel. So we have to, if it's greater than 65, we need to rule out malignancy or chronic pancreatitis or inflammatory bowel disease. So if there is constipation, then we can give Vicilium or PEG. Okay. And then if there is second line is linaclotide, guanosilate cyclase ago, or sodium hydrogen exchanger. Okay, so acute pancreatitis we have less than 48 hours. Severity we need to know for we can know the severity, like if it's less than 48 hour. Ranson score, AST ALT, AST greater than 250, so it's a poor predictor. So although Ranso score is a poor predictor, again, so less than 48 hours, Ranso AST greater than 250. So currently you use the Apache 2 or SIR2 score or BSAP score. Again, Apache 2, Apache बाइक छ नि, त्यसले चाहिँ पेन्काटाइटिसको डायग्नोज गर्ने के अरे यसको स्कोरहरू छ, अथवा SIRS स्कोर सिङ्गल. So in single you use the hematocrit or BUN. Okay, older age, obesity, or CRP. Okay, so main is the hematocrit. Okay, how is the hematocrit in acute pancreatitis or BUN? So a hematocrit or BUN for acute pancreatitis. See how funny it is. We are checking the GI using the hematology or renal function. Okay, so greater than 44% more severe disease, increase during admission, and bond greater than 20, it's person is death. Bond, if it's bond is greater than equals to 20, death. CRP greater than 150. So if you say single factors, now we have a single factor, like if it's hematocrit is greater than 44%, more severe disease, increase during admission, bond greater than 20, the person is most likely to die. If it's CRP is greater than 150, children. If it lipase is greater than 1000 creatinine, okay, 1000 times increase. Okay, worsen. So if lipase is greater than 1000 in children in admission, so it is worsens. Okay. So now we have infectious gastroenteritis. So infectious gastroenteritis, no empirical antibiotic. Example, bloody diarrhea, anti-hemodynamic unstable. Okay, so infectious, although it is infectious gastroenteritis, no empirical antibiotic. Even example, bloody diarrhea, until hemodynamically unstable नै भइरहेको छ भने चाहिँ बल्ल bloody दिने होइन. Otherwise even gastroenteritis we are doing dehydration, oral elastase. Okay, okay, rehydrate, will rehydrate only dry lips, so only dry lip and normal vitals. Okay, so we will check the dry lips and the vitals. Okay, dry lip and lip कस्तो छ. So no blood, no fever, rehydrate only. So in cases of no blood, no fever, not hospitalized, not elderly, not immunocompromised, diarrhea not greater than 7 days. If any, then we have to do. So if there is any blood, fever, or if there is any elderly patient or diarrhea greater than 7 days, so diarrhea greater than for 7 days, always do WBC. स्टुलको हामीले WBC हेर्नु पऱ्यो, कल्चर हेर्नु पऱ्यो, मल्टिप्लेक्स PCR, त्यस मल्टिप्लेक्स सबैलाई हेरेर PCR गरिदिने. अब त्यसपछि तिम्रो ब्लड होइन, अब 7 दिनभन्दा बढी डायरिया भयो, अथवा तिम्रो फिभर भयो, ब्लड आइरहेको छ, नो फिभरहरू छ होइन, होइन फिभरहरू छ भने चाहिँ तिमीले अब स्टुल पहिला गर्नु पऱ्यो. स्टुलमा चाहिँ अब के देखिदियो भन्दाखेरि तिम्रो ब्लड छ र डब्लुबिसी छ भने चाहिँ बल्ल अब हामी एकातिर लाग्यौँ होइन। ब्लड अब स्टुल गऱ्यौ तिमीले स्टुलमा चाहिँ के हेऱ्यौ भन्दाखेरि कल्चर गऱ्यौ, डब्लुबिसी हेऱ्यौ र ब्लड हेरेछ। अब ब्लड र डब्लुबिसी छ भने चाहिँ सिगेला टक्सिन इकोलाई हुनसक्छ, स्ट्याक हुनसक्छ, एभोइड एन्टिबायोटिक, एचयुएस रिस्क होइन। अनि पिसिआर त्यसपछि अब पिसिआर गरेर छुट्याउनु पऱ्यो क्या, पिसिआर गरेर हो कि होइन भनेर छुट्याउनु पऱ्यो होइन। ब्लड र डब्लुबिसी छ भने चाहिँ हाम्रो सिगेला हो कि सिगेला लाइक टक्सिन इकोलाई हो अब होइन। यो दुइटैले चाहिँ तिम्रो कज गर्न सक्छ एचयुएस। सो एन्टिबायोटिक चाहिँ दिनु भएन। अब त्यतिखेर चाहिँ पिसिआर गरेर छुट्याउनु पऱ्यो के हो भनेर होइन। अब तिम्रो पिसिआरमा चाहिँ नन स्टेक भयो भने एन्टिबायोटिक फर, अब एन्टिबायोटिक पनि यसमा दिनिहाल्ने त होइन कि। एन्टिबायोटिक फर सिभियर डिजिज, एल्डरली, इम्युनोकम्प्रोमाइज अनि सिगेला। So in Shigella you can give the antibiotics for severe, अब सिभियर डिजिज छ, अब एल्डरली छ र के अरे सिगेला छ होइन, बल्ल एन्टिबायोटिक एकदम सिम्पल छ। ब्लडी डाइरिया भयो भने डब्लुबिसी हेर्नु पऱ्यो र स्टुलको कल्चर गर्नु पऱ्यो। स्टुलको कल्चर गरिसकेपछि अब ब्लड र डब्लुबिसी बढेको छ भने गोमा होइन, त्यहाँपछि चाहिँ हामीले पिसिआर गर्नुपर्छ होइन, कुन अर्गानिजम हो। अब एल्डरली सिभियर छ भने चाहिँ तिम्रो एल्डरली छ, सिभियर छ, इन्कम्प्राइज छ भने चाहिँ बल्ल एन्टिबायोटिक दिनु पऱ्यो है। फर्स्ट टेस्ट इन्फेक्सियस ग्यास्ट्रोएन्टराइटिस, ओरल हाइड्रेसन, देन इन्भेस्टिगेसन। पहिला चाहिँ ओरल इन्भेस्टिगेसन पहिला दिनु पऱ्यो होइन, हाइड्रेसन त्यसपछि गर्नु पऱ्यो। अब एसआइबिओमा चाहिँ तिम्रो के छ भन्दाखेरि ट्रिटमेन्ट इज फ्लोरोक्विनोलोन्स, मेट्रोन हो कि। एन्ड सो वी हेभ रिकरेन्स कमन, so prophylactic antibiotic to be given, okay. So recurrence is common, so prophylactic antibiotic, disaccharide enzyme form carbohydrate H2 methane, deconjugate bile acid impair fatty acids, okay. So deconjugate bile acid impair हुन्छ कि, deconjugate गर्न चाहिँ इम्पेयर हुन्छ अनि त्यसले चाहिँ इन्ट्रोसाइड्सहरूलाई भइन्छ। सो रिफाम्जिमिन or amoxiclav, okay. So anything you can give, rifaximin, amoxiclav or fluoroquinolones or metron. C difficulty fever and WBC. So fever clostridium difficile as SIBO is cause, okay. Clostridium difficile as fever and WBC, okay. Fever or WBC भने C difficile पनि सम्झिनु पर्यो। watery diarrhea, fever with WBC is C difficult. SIBO cause stricture surgery, okay. So SIBO can be from stricture, surgery, diabetes, opioids, scleroderma, IgA deficiency, chronic pancreatitis, PPI or decreased HCl, endoscopic USG. So when to do endoscopic USG, okay. So in cases of pancreatic lesion, cyst, pancreatic cyst or non-neoplastic neoplastic cyst, biopsy pancreas, okay. For biopsy pancreas also we can do endoscopic USG, okay. And liver adrenal gland, for the liver we can do, for the adrenal gland, how to reach adrenal gland USG, endoscopic USG, okay. Adrenal gland or bile duct or peritoneal fluid or pleural fluid, okay. So biopsy, so we can do the endoscopic USG for pancreatic cyst, neoplastic cyst, biopsy from pancreas, liver, adrenal gland, bile duct, biopsy fluid or pleural fluid. ERCP is choledocho, dilated CVD, cholangitis or acute biliary pancreatitis. So in acute biliary pancreatitis also we are doing ERCP. Increase CA, cystic lesion pancreas, okay. Increase CA, cystic lesion pancreas, malignancy, okay, and can be asymptomatic. So benign non-neoplastic, if it is you find the benign and non-neoplastic in then do 3 to 6 months CT, okay. So cholecystectomy complication can be even can cause cholangitis, okay. Can even cause cholangitis. Cholecystectomy complication can cause cholangitis like biliary stricture. It can be happening of biliary structure, maintain biliary malignant biliary obstruction, post migration biliary clip, okay. Drug induced liver injury also increase ALP, HUS decrease platelets. So E. coli 157, HS, beef, lettuce. So it can cause from beef or lettuce, it can cause bloody diarrhea, okay. So beef को मासु खाने मान्छेहरूलाई चाहिँ ब्लडी डायरिया लुटिसहरूबाट हुनसक्छ। एक्युट कोलान्जाइटिस, बिलेरी ड्रेनेज बाई ERCP less than 24 to 48 hours. Okay, so if you have somebody who has acute cholangitis, then there must be biliary drainage by ERCP less than 24 to 48 hours. Okay, and biliary drainage by ERCP. HIDA scan if USG is negative for acute cholangitis plus severe gallbladder stone. Okay, if there is acute cholangitis or if there is a severe gallbladder stone, USG Murphy's sign or common bile duct is normal. So if so the main thing is but the common bile duct should be normal. Okay, so if common bile duct is normal, okay, common bile duct is normal, common bile duct is normal, and if you see the features of Murphy's sign, cholangitis, okay, and USG mutations, then so immunodeacidic cholecystography 90% cystography if USG negative for, okay, so if USG is negative for acute cholangitis but severe GB stone or USG Murphy. So if says that if USG is negative for acute cholangitis or if there is severe GB stone and USG Murphy's. Okay, so if USG is negative for acute cholangitis and if there is severe gallbladder stone, several gallbladder stone, USG Murphy's. फिचर छ होइन, तर युएसजी चाहिँ नेगेटिभ आयो कि सबै कुराको लागि हिडा गरिदिनु भयो. एक्युट क्यालकुलस कोलिसिस्टाइटिस नर्मल एलएफटी बिलिरुबिन एन्ड एलपी. ओके, एक्युट क्यालकुलस कोलिसिस्टाइटिस, सो एभ्रिथिङ विल बी नर्मल राइट. स्टोन मध्ये के छैन. बिलियरी कोलिक लेस देन 6 आवर, सिटी जिबी पर्फोरेसन, ESRD uremia cause platelet dysfunction. Okay, so platelet dysfunction happens in so uremia बढ्यो कि platelet उड्यो. Okay, so in bone marrow band is age greater than 60. Aortic stenosis is associated with angiodysplasia which is painless. Cherry red lesion colon मा हुन्छ हैन. Occlusion of submucosal veins, so submucosal vein को occlusion भएर हुन्छ. अनि vascular ectasia, IV malformation, small cherry spot lesion, dermatomyositis associated cancer lung, colon, ovary. Okay, dermatomyositis associated cancer lung, colon, ovary. Ulcerative colitis of Crohn's associated with ankylosing spondylitis. Carcinoid tricuspid valve regurgitation. Okay, so in carcinoid we have tricuspid valve regurgitation. So next we have the cirrhosis, hepatic right side transudative pleural effusion. So in this case we have a right hemodialysis thinner porous defect. Okay, so it can cause light criteria fluid to serum. Okay, here we do fluid to serum. Okay, protein LDH and acylated LDH. So here treatment is like sodium restriction. Okay, sodium restriction, diuretics and refractory tips. You can give spironolactone. Okay, simply the fluids, diuretics. So why it happens is cirrhosis led to right side transudative pleural effusion. So even cirrhosis patient we have right side pleural effusion. Okay, so that's the combination porous defect and so advanced liver disease. Okay, so malignant exudative pleural effusion, malignant exudative pleural effusion. If it is malignant, then we do TAC, IC chemical pleurodesis. Okay, if that is then malignant, then we can do pleurodesis. Tips is fistula, portal vein and hepatic vein. Fistula between portal vein and hepatic vein. Risk of HC. So we do tips matching fistula, portal vein and hepatic vein. Okay, so resolve ascites and decrease portal pressure. Sharp object endoscopy removal. So fish like माछा भयो होइन, अनि बोन भयो, निडल भयो, अनि पिन भयो, यस्तोलाई चाहिँ एन्डोस्कोपिक रिमुभल गरिहाल्नुपर्छ. ओडाइनोफेजिया, पेन, स्वेलिङ, अर्जेन्ट एन्डोस्कोपी, प्रिभेन्ट ओसोफेजियल पर्फोरेसन. फर्स्ट weak lactational failure, jaundice, is decreased bilirubin elimination is the sign of dehydration. Okay, so if we have a jaundice in first week, that could be lactational failure jaundice, decreased bilirubin elimination, sign of dehydration. In second week, peak, फर्स्ट डे फर्स्ट 3 to 5 डेजमै स्टार्ट हुन्छ हुन चाहिँ, तर पिक चाहिँ तिम्रो सेकेन्डमा हुन्छ, द्याट इज ब्रेस्ट मिल्क जन्डिस हो कि. सो इफ इट्स लाइक इन सेकेन्ड विक, सो मिल्क खुवाउँदा पनि जन्डिस कि, फर्स्टमा चाहिँ फेलियर हुन्छ होइन, सेकेन्ड विकमा चाहिँ तिम्रो पिक हुने भनेको चाहिँ हाई मिल्क जन्डिस हो कि, ब्रेस्ट मिल्क जन्डिस. सो हियर इज हाई बिटा ग्लुकुरोनिडेज, सो इट कन्भर्टेड टु अनकन्जुगेटेड बिलिरुबिन, एन्ड examination is normal, increase enterohepatic okay, circulation. So ABO in captivity, mother is blood group O negative, no. If mother is O and children are ABO, then okay, so that's the another thing. Okay, biliary atresia, direct bilirubin is greater than 20 of total percent bilirubin first 2 months of life में biliary atresia हुन्छ. So Gilbert चाहिँ adolescent में present हुन्छ. Conjugated hyperbilirubinemia always pathological. USG for liver atresia. Okay, so bilirubin, conjugated bilirubin in direct one is always pathological. Okay, so Epstein-Barr virus, there is a splenic rupture. So splenic rupture, and we give like so is splenic rupture, Epstein-Barr virus splenic rupture can give shock, volume resuscitation, okay, and there is a monosport, infectious mononucleosis. Epstein-Barr virus, we have splenic rupture, so it can cause CMB, also CMB, spleno children and adolescent, left upper quadrant pain. Okay, so splenic is left upper quadrant pain, splenic rupture, also CMB, child and adolescent, monosport, infectious mononucleosis. Okay, so infectious mononucleosis begin everything there. There can be shock or second week pharyngitis, second week after pharyngitis. So 2 weeks after pharyngitis it can go there. Okay, shock, right volume resuscitation, lymphocyte stage capsule, refrain from sports, SBP greater than 90, hemoglobin measure, embolization stable, CT contrast and exploratory laparotomy, and we do splenectomy. Okay, so next is diarrhea, blood plus mucus. So there is a cigar toxin, could be amoeba, Shigella, Zika, okay, Salmonella can be there, versus inflammatory bowel diseases, episodic, ischemic colitis, hypoperfusion, crampy pain would be there. So only antibiotic when hypovolemia greater than 7 days. Okay. So all patient we need to have to do culture, WBC, multiplex PCR stool testing, and fecal WBC, abdominal CT, ischemia, hypovolemia. Okay, so when to, and only antibiotic when hypovolemia greater than 7 days. Identify pathogens, elderly, immunocompromised one. Okay, so hepatic adenoma. So in cases of hepatic adenoma, OCP can happen, and then if less than 5 centimeter, discontinue, else surgical, also with symptoms. Okay, episodic abdominal pain, the OCP can give hepatic adenoma, well circumcised with peripheral enhancement. CT shows sample UMC, no biopsy, contrast. So hepatic adenoma, 10% risk of malignancy transformation. So imaging plus alpha fetoprotein need to be done. Liver and yolk sac tumor but आउँछ, less than equals to 5 centimeter, discontinue, or else surgical, also with symptoms. So generally less than 5 centimeter we need to just discontinue the medication, and it can go away, else we need to do the surgery with the also with the symptoms. Okay, so CT well synchronized with welfare enhancement in city with contrast, and sample insufficient, so no biopsy. So generally, we just do CT with contrast. We do not do biopsy in hepatic adenoma. Okay, and we need to check the alpha beta protein, liver, and yolk sac. So echinocosis cause a hepatic cyst. CT need to be done, and a cyst with fluid, peripheral calcification, and separation. Okay, so H. pylori 50% gastritis, 80% duodenal, gastric adenocarcinoma or lymphoma, also immune thrombocytopenia. So stool antigen test, eradication greater than 4 weeks after treatment confirmed, persistent symptom, endoscopy also malignancy, penicillin allergy, amoxi replaced by metron. Okay, so penicillin, if there is a penicillin allergy in the metron giving, so I replace by amoxicillin, it can be replaced by metron. Okay, so quadriplegia, bismuth, tetracycline again, and high macrosomia, metron resistance 50%. High macrosia, metron resistant 50% classical. Okay, so bismuth is prevent bacteria bind to mucosal cell and decrease inflammation, fluid plus electrolyte, misoprostol, prostaglandin plus from NSDs, cause of irritable uh, again bismuth prevent bacteria bind to mucosal cells and decrease infiltrate and fluid and electrolyte. Cause of irritable bowel syndrome is contracture, flora, immunity, and sensitivity. Extra infection bowel, uveitis. So extra inflammatory bowel have uveitis, arthralgia, erythema nodosum. So irritable bowel have constipation, CBC, abnormal colonoscopy, diarrhea. You need to do all those things like CRP, culture, celiac test, rule out additional. You can do colonoscopy, celiac, diffuse villus atrophy, irritable normal colon, mucosa colon cancer. Okay, oral candidiasis, esophagus, nystatin, oral fluconazole if resistant. So we can give here the different things like oral fluconazole if resistance. First, candida we are giving the suspension with nystatin. Okay, quatrimoxazole suspension also we can give. So it enzymes demethylase. So all azoles are like 14 alpha lansitol inhibitor, cause can be inhaler, treatment drains mouth, corticosteroids. Okay, cause inhaler. So corticosteroids. Okay, so the cause can be like if somebody is taking corticosteroids, we need to rinse the mouth again from the inhaler, and decrease enzyme methylation of 14 alpha lansitol, not from milcosterol, and damage. Okay, and dyspepsia greater than equals to 1 month, if gastric pain, postprandial fullness plus minus nausea. So greater than equals to 60, greater than equals to 1, less than 60, greater than 60, endoscopy plus biopsy, less than 60 endoscopy, significant weight loss, overt bleeding, any like persistent vomiting, diarrhea, iron, lymph mass, lymph node, increased progesterone, especially odonophagia, most cause idiopathic. In 25% PUD, GARD, male, NSDs, bisphosphonate, if no cause, PPI, barium swallow, diffuse esophagus spasm, or variant see in diffuse esophageal spasm or esophageal stricture, just 60% dyspepsia, stool antigen, urine blood test. Okay. So biliary atresia, disease due to USC, eosinophilic esophagitis, that is greater than 15 eosinophils per high biofuel, 20 to 30 months of food infection, bio, asthma, food allergies, and associated, so 50% into allergic rhinitis, history of heart deposit, high dose heartburn, despite high dose PPI. Okay, so high dose despite high dose PPI, now we think of eosinophilic esophagitis. So eczema, the person can have eczema, treatment with topical glucocorticoid plus PPI again. You can have fluticasone or budesonide spray swallow. Okay, so you can give topical glucocorticoid like fluticasone, budesonide spray swallow and PPI. So there can be ring stricture linear furrows. Okay, so it is a ring to stricture हुन्छ त्यहाँ the linear eosinophils are linear. Furrow refractory, add one small white maple, avoid allergic food, plus 6 month avoid milk, egg, soft wheat, peanut and fish. Unisaccharide, DMD, DMRD, inflammation bowel, rheumatic arthritis, helminth, peripheral eosinophilia, ALS, MS, disordered oropharynx, neuromuscular transmission, and illness MLS. Okay, so cough after eating, nasal regurgitation. So next we have the Barrett oesophagus. Here distal oesophagus, less than 1% of per year risk of esophageal adenocarcinoma. Chronic GRD, long life PPI, 5 to 10 years. Chronic GRD only cause Barrett oesophagus. So white central obesity, tobacco use, columnar repels, velvety plus globulate cells with high grade dysplasia, PPI endoscopic eradication, dyspepsia, H. pylori atopic gastritis, alendronate, punched out ulcer, plus inflammation infiltrate, radiation proctitis within 6 months, and there is ineffective or PPI strain. So diarrhea, mucus occult, stricture, fistula, and rectal bleed. Okay, so radiation proctitis within 6 months, exclude the infection, ischemic, inflammatory bowel malignancy, ineffective or painful strain, diarrhea, mucus occult, chronic radiation, stricture, fistula. So radiation within like 6 months, first we need to exclude other like infection, ischemia, inflammation, malignancy. So it can be ineffective or painful straining. Okay, painful straining, chronic radiation can cause stricture, diarrhea, rectal bleed, diarrhea, mucous membrane, occult bleeding. Treatment supportive, antidiarrheal versus chronic care, sucralfate. So in cases of radiation proctitis where there is a painful straining, okay, painful straining and diarrhea, so in this case we can support the anti-diarrheal. So if there is a diarrhea like radiation proctitis, we can give the anti-diarrheal, okay, like loperamides, and versus chronic care can be given with sucralfate or glucocorticoid or inivaz. Okay, sucralfate. Okay, chronic cases within 6 months. Okay, so we can use either like anti-diarrheal and radiation proctitis. Okay, greater than 60 age, greater than 60, fresh bleed, angiodysplasia, ischemic colitis. Okay, so ischemic angiodysplasia is like painless bleed. So if age greater than 60 and there is a fresh blood, so also think of painless bleeding, angiodysplasia, ischemic colitis can be there. C. difficult pseudomembranous colitis, fever plus increased WBC, raised yellow white plaque scattered over colon mucosa. Okay, yellow white plaque. So dumping syndrome after gastrectomy, so jejunum, abdominal pain and diarrhea, and dizzy, sweat, okay, and dyspnea. There is more frequent meal. So here there is a very specific thing. Okay, so like we need to take the more of protein in dumping syndrome, more of protein, low carb. Okay, like I'm taking right now, very high protein, low carb, and diet relieves symptoms. Okay, so diet relieve symptoms, more frequent meals, high protein and low carbs. So achalasia, mesenteric crisis, progesterone solid and progressive, solid plus liquid. Yeah, solid plus liquid तर progressive हुन्छ यो दुईटैमा हैन, solid to liquid plus हुन्छ. Systemic sclerosis, fibrosis plus atrophic smooth muscles of esophagus, severe GRD, skin thick, Raynaud-Fenton characteristics, malignancy, prognosis, solid, liquid plus weight loss, and gastroparesis. So there must be decreased fat, soluble fibers only first, and metoclopramide, erythromycin, and less than equal to 4 weeks use. Trackidna, if it decrease effectiveness. Biofeedback, control blood, 9, heart rate, bleed pattern, muscle rupture. Biofeedback is control body mind, okay, heart rate, heart breath pattern, muscle response. Cyclic vomiting, treatment is cyclic vomiting syndrome. No, diagnosis can be cyclic vomiting syndrome, nausea, vomiting associated with chemo. So to biofeedback treatment चाहिँ हामीले कसलाई दिने भन्दाखेरि जसलाई चाहिँ साइक्लिक भमिटिङ सिन्ड्रोम छ र nausea, vomiting associated with chemo छ कि you have to give them so that their body mind becomes control, okay, body mind. So cyclic vomiting syndrome and nausea, vomiting with chemo, we give the biofeedback. Gallstone pancreatitis, clinical improve within 7 days, cholecystectomy. Okay, cholecystectomy clinical improve within 7 days, cholecystectomy, no necrosis or heart failure. If not removed, 30% risk of recurrent cholecystitis next 6 to 18 weeks. Okay, so gallstone pancreatitis त्यहाँबाट झरिरहेको हुन्छ, त्यही भएर 7 दिनको भित्रमा चाहिँ तिमीले त्यो हटाइदिनुपर्छ, नत्र अर्को एपिसोड चाहिँ तिम्रो अब नेक्स्ट 1.5 महिनापछि चाहिँ 100% हुन्छ क्या. Okay, so GIT oesophagus, battery, endoscopic removal, X-ray, radio open, double ring, beyond mucosa, oesophagus injury. So अब ब्याट्रीहरू भयो, चोखो चिज फास्ट कुराहरू भयो, तिनीहरू चाहिँ हटाइदिने. अपर जिआई सिरिज, स्ट्रक्चर, डिस्पेजिया, oesophagus, barium or water soluble contrast in till feast of duodenum, flexible sigmoidoscopy 5 years or 10 years. Okay, and finds villus adenoma, colonoscopy, entire colon to be done. After 1 month of infant, normal decreased infant bowel movement. After 1 month of infant, normally decreased infant bowel movement, even 1 bowel movement per week. So after 1 month of age, there is decrease in bowel movement, that is normal for the newborn 48 hours. Black terry stool, meconium, breastfeed, yellow, green stool. Okay, see no enemas, abdominal distension, poor feed, failure to thrive. So newborn infant, acute severe constipation, glycerin support. Okay, so if a newborn in within 48 hours 48 hours मा न्युबर्नले भनेको 2 दिनभित्रमा न्युबर्नकोमा चाहिँ ब्ल्याक टेरी स्टुल, मेकोनियम. सो मेकोनियम इज अ ब्ल्याक एन्ड टेरी स्टुल. ओके, ब्ल्याक एन्ड टेरी स्टुल कालो हुन्छ मेकोनियम होइन, टेरी स्टुल हो होइन. ब्रेस्ट फिडमा चाहिँ येल्लो ग्रिन स्टुल हुन्छ होइन. ब्रेस्टमा चाहिँ ब्रेस्ट फिड गरिसकेपछि येल्लो ग्रिन भयो नर्मल होइन. ब्ल्याक टेरी चाहिँ मेकोनियम भयो होइन. सिनो इमेसिया, एब्डोमिनल डिस्टेन्सन, पुवर फिड, फेलियर टु थ्राइभ. नो अब अरू कुराहरू छैन कि, एब्डोमिनल डिस्टेन्सन, पुवर फिड, फेलियर टु थ्राइभ छैन होइन. एक्युट सिभियर कन्स्टिपेसनमा वी क्यान गिभ ग्लिसरिन. वी आर नट जस्ट गिभिङ ग्लिसरिन फर द बच्चा इन सिभियर कन्स्टिपेसन. एडोमेटस पोलिप ग्रेटर देन 10 mm, 2-fold rise in adenomatous polyp. Okay, adenomatous polyp very increases greater than 10 mm, 2-fold rise in colorectal cancer. So 40 is colonoscopy, follow history, primary CRC less than 60, 10 years prior, repeat 5 years. Okay, yeah, less than 60, 10 years prior में करना पड़ेगा ना. So next is gastroesophageal reflux. Okay, so happy splitters first month to 18 month of life. मजाले निकाल्छ, खाए फाल्ने खाने खाने फर्स्ट देखि 18 months भनेको लगभग 1.5 वर्षसम्म खाने निकाल्ने. ह्याप्पी स्प्लिटर्स इन्फन्ट. सो फिजियोलोजिकल स्प्लिट अफ. ओके, वेट गेन प्लस नो पेन विथ फिड. ओके, स्प्लिट अफ वेट गेन, बर्पिङ डकार लिन्छ होइन. अनि नेक्स्ट रिल्याक्स इमेच्योर लोवर स्पिन्टर बिकज अफ द इमेच्योर लोवर स्पिन्टर. सो अपराइट र स्मल फिड गर्नुपर्छ है. सो अलवेज त्यसरी खुवाउने होइन सुताएर. upright position, and then you have to feed the baby. Okay, so different from GERD. This is just gastroesophageal reflux. Okay, so gastroesophageal reflux disease. So in disease one, there is weight loss, feeding diffusal, aspiration, back pain, irritable during feed. So here we give famotidine. Okay, so we give a H2 blocker, the famotidine, and no cow milk. Okay. So in constipation, we are using glycerin in children. In here, just if it is a disease, then use the famotidine. Okay, infection or some amoxicillin by SAGMA greater than 1.1 is portal hypertension, cystic cirrhosis. Okay, so congestive heart failure. So cirrhosis is the main. You need to remember SAG greater than 1.1. Okay, so there will be portal hypertension. So that is now associated with cirrhosis. अरू के कारणले हुनसक्छ भने चाहिँ नि अब तिम्रो कन्जेस्टिभ हार्ट फेलियर कज गर्न सक्छ। अनि यतातिर मुनि अब तिम्रो त्यही नजिकै बर्डचेरी छ, बर्डचेरी हुनसक्छ र तिम्रो अल्कोहोलिक हेपाटाइटिस पनि तिम्रो त्यही हुने भयो। सिरोसिस जस्तो सिरोसिस तिम्रो साग ग्रेटर देन 1.1 के भन्छ नि अल्कोहल वाट आर द कजेस अफ साग ग्रेटर देन 1.1 अल्कोहोलिक सिरोसिस, alcoholic hepatitis, cirrhosis, and butchery, and congestive heart failure. Okay, good. So and less than 1.1. So less than 1.1 is very crucial. That is, you must think first of the like peritoneal carcinomatosis. Okay, so cancers can be there. This means that the ascitic protein are more. Okay, so ascitic protein चाहिँ हाम्रो केमा बढ्न सक्छ भन्दाखेरि क्यान्सरमा, peritoneal TB, nephrotic syndrome, and ascites. So that means there is a more protein in the ascitic fluid. So can be cancer, ovarian cancer, peritoneal cancer, or nephrotic syndrome can leak the protein over there. Okay, and serositis. Okay, nephrotic syndrome, serositis, TB. Okay, so lower GI, bright red blood per rectum, stable patient, colonoscopy. Okay, and lower GI, bright red blood per rectum, stable patient, colonoscopy, stable patient, negative colonoscopy, do capsule endoscopy. So if lower GI, bright red blood per rectum, stable patient, do colonoscopy, endoscopy, if then capsule endoscopy. So upper GI bleed, we have burn to creatinine more than 20. Okay, so it's a pre-renal, so it will be more than 20. Hematoemesis, melena, nasogastric lavage with aspiration, and absence of clot suggests lower bleed. Okay, so if so hematoemesis, melena, so nasogastric lavage plus aspiration. If it's melena, we need to just nasogastric lavage and aspiration of an absence of blood suggests lower GI bleed. So diverticulosis is a painless hematochezia in elderly. Okay, so diverticulosis is not painful, it's a hematochezia. Okay, so hematochezia is unstable, orthostatic hypertension, resuscitation, consult and do endoscopy. If hematochezia means blood loss is making you unstable, then consult for first do endoscopy. Okay, that's very important. Like if there is hematochezia, then you have to do endoscopy first. Not found source, then you have to do angiography. Okay, and embolization, then not found, then colonoscopy, then not found is capsule endoscopy. So is very different. Okay, so there are two things. If it's lower GI, bright red blood per rectum, first to do colonoscopy, and if it's hematochezia, then you need to first visit the patient and do endoscopy. Okay? Hematochezia. And next is we have aplasia, that is air fluid lever, barium empty delayed. Okay, barium empty delayed, bird big. It's lymphocytic constriction, lower esophageal sphincter, inflammation, degeneration, ganglia, myenteric, my ecclesia, say my, my, inhibit neurons, whereas or exciter in ESCH, systemic sclerosis, fibrous dysplasia of esophagus, mucous muscularis propria, polymyositis is mononuclear infiltrate in muscle, that is lymphocytic, oropharynx, proximal 1/3 esophagus, esophagus adenoma, pleomorphic epithelial cells from infiltrate gland. Okay, so it is mainly affecting proximal 1/3 of esophagus or oropharynx. Okay, mononuclear infiltrate in muscles, lymphocytic, and polymyositis is esophageal adenoma, pleomorphic epithelial cells forming infiltrate. Acute cholangitis is mild increase in AST, ALT, biliary obstruction, or they have to do ERCP. Okay, so HIDA patency to see cystic and common bile duct. Okay, in acute cholangitis we do HIDA to see patency to see cystic and common bile duct. ERCP increase 24 to 48 hours plus antibiotic coverage गर्नु परिहाल्यो होइन. And if dilation seen in CBD but no stone, still ERCP. If dilation seen in CBD but no stone, still ERCP. If dilation seen in CBD but no stone, okay. Dilation is seen in CBD, there are no stone found in the dilation still into the ERCP. Wireless video capsule endoscopy, when endoscopy and colonoscopy fail to visualize the bleed source. Orthostatic hypertension is considered unstable. Vitals, so orthostatic hypertension is considered unstable. Vitals, endoscopy, dyspepsia. Think of age and alarm symptoms, weight loss, iron decrease, or family history of malignancy. Diffuse esophageal spasm, that is due to manometry, normal relaxed sphincter. Treatment is calcium channel blocker, both solid and liquid. Okay, diffuse esophageal spasm, solid liquid डिक्टे आउँदैन होइन. अनि चेस्ट पेन हुन्छ, डिस्पेप्सिया हुन्छ, रेट्रोस्टर्नल पेन, एन्ड इट इज डिस्टल ओसोफेगस. ओके, सो डिस्टल ओसोफेजल स्पाजम इज डिस्टल, sorry, diffuse esophageal spasm is distal, whereas poliomyositis is proximal. Okay, and both solid and liquid हुन्छ, and अक्लेजियामा पनि बोथ सोलिड एन्ड लिक्विड. सो डिस्टल त्यहाँनिरको दुइटै डिफ्युज एसोफेजियल स्पाजम थियो, बोथ सोलिड लिक्विड हुन्छ, सिस्टेमिक स्क्लेरोसिससँग एसोसिएटेड हो होइन. अनि म्यानोमेट्री वी क्यान डु कन्ट्र्याक्चर लो एम्प्लिट्युड, कन्ट्र्याक्सन अफ लो एम्प्लिट्युड, अनि त्यसपछि लो स्पिन्चर इन्क्रिज प्रेसर हुन्छ, लो स्पिन्चर इन्क्रिज प्रेसर हुन्छ, कन्ट्र्याक्सनमा लो एम्प्लिट्युड देख्छ होइन. सेकेन्डरी अक्लेजिया इज टुक्रोजीले चाहिँ हाम्रो सेकेन्डरी अक्लेजिया कज गर्न सक्छ, डाइलेटेड ओसोफेगस हुन्छ होइन. एन्ड प्लम्बर विन्सन सिन्ड्रोममा चाहिँ हाम्रो के हुन्छ भन्दाखेरि ओसोफेजियल वेभ हुन्छ कि, हो डिफ्युज ओसोफेजियल स्पाजम त भन्यौँ, तर हाम्रो वेभ हुन्छ. अब यहाँ चाहिँ मेन तिम्रो के हुने भयो भने प्लम्बरहरूको हातमा हान्दा होइन, प्लम्बरहरूले यस्तो गर्दाखेरि आइरन ब्लड लस, आइरन कम भइदिन्छ कि. अनि त्यहाँपछि अब वेभ भएपछि ओसोफेगसमा चाहिँ तिम्रो हुने भयो इम्प्रुभ विथ आइरन रिप्लेसमेन्ट. सो प्लम्बर विन्सन इम्प्रुभ विथ आइरन रिप्लेसमेन्ट. So dyspepsia, iron deficiency. If there is someone with dyspepsia, iron deficiency, so think of plumber Vinson syndrome. Treatment is iron restore. Chest pain, retrosternal. Okay, you have a chest pain and retrosternal. Chest pain is esophagus. Okay, so diffuse esophageal spasm. We can see corkscrew pattern, and here we need to give calcium channel blocker. Nitrates or strictures. So manometry have to be done. Intermittent peristalsis with multiple simultaneous contracture, premature, normal, lower response, esophageal sphincter. So varicose bleed, subbacterial peritonitis risk. We are giving ceftriaxone to give for 7 days. Discharge switch to fluoroquinolones. Okay. So large bowel, intestinal lumen, decreased blood, intestinal blood. So creates chance of E. coli. Okay? So large blood in intestine lumen, decreased blood in intestine blood flow, creates chance for E. coli Klebsiella into peritoneum. Okay, Klebsiella peritoneum जान दिन्छ हैन. DIC prevention by antibiotic, and for pulmonary syndrome, intrahepatic shunt and paroxysmal dyspnea of right. Warning is in chronic alcoholic. SBP is a fever, abdominal pain, automatic status. Absolute neutrophil count is greater than 250. E. coli Klebsiella 50% culture, protein less than 1, SAC greater than 1.1. Okay, so delayed gastric emptying is succussion splash, decreased motility, first step to route obstruction endoscopy, motility, gastroscopy, decrease, and nuclear gastric emptying study. So if there is anticholinergic, diabetes, post-surgical, post-viral, opiates, MSTS into rule out. So delayed gastric emptying, we have the small bowel pathology, extrinsic or intrinsic, CT, endoscopy plus minus CT, MRI or barium minima as follow through. Intrinsic cause delayed gastric convey, stricture, gastrin malignancy, foreign body, gastric, okay, small bowel maintain, extrinsic mass can be of malignancy, superior mesenteric artery syndrome. Okay, so extrinsic mass, malignancy or superior mesenteric artery syndrome. Ibuprofen, peptic ulcer disease, mesenteric ischemia, abdominal brew, first hours of eating pain. So food protein बच्चामा 1 to 4 weeks को बच्चा र प्रोक्टेटाइटिस भइरहेको छ हैन. अब ब्लड प्लस म्युकस भयो, इलिमिनेट्स काउ मिल्क खानु भएन कि बच्चाको. काउ मिल्कले एक्जिमा हेमोग्लोबिन हिस्ट्री हेर्नु पर्यो. अनि त्यसपछि तिमीले योगर्ट फ्यामिली हिस्ट्री नो अर फुड एलर्जी अर सो प्रोटिन टिल 1 year रिजल्भ विदिन 2 weeks. तिमीले अब यहाँ चाहिँ तिमीले क्यासिनहरू होइन, काउ मिल्कहरू, क्यासिन, योगर्ट, फ्यामिली हिस्ट्री अर फुड एलर्जी हेर्नु पऱ्यो. सो प्रोटिन टिल 1 year यिनीहरू चाहिँ खानिदिनु भएन कि. इलिमिनेट गर्नु पऱ्यो काउ मिल्क, योगर्ट, फ्यामिली हिस्ट्री अफ फुड एलर्जी, सो प्रोटिन टिल 1 year रिजल्भ इन 2 weeks. यिनीहरू हटाउने बित्तिकै तिम्रो ब्लड म्युकसहरू काउ मिल्क नहुँदैकै सबै ठिक भइहाल्छ होइन. एन्टरकोलाइटिस can happen, non-IG, it's cow milk, inflammation and trick target small bowel, profuse blooding within 4 hours, diarrhea plus minus blood, lethargy, dehydration. So so we need to give formula feed, switch to hydrolyzed feed, non-IG, eosinophilic inflammation, rectosecond colon, less than 6 months, blood streak, blood stool, annual fissure हुन सक्छ हैन. अब less than 6 months मा के हुन सक्छ, annual fissure or food protein induced allergic proctitis सक्छ. Mucus diverticulum presents with greater than 6 months पछि हुन्छ है. Mucus diverticulum 6 महिना पछि बच्चाको. Intestinal ulceration, intestinal obstruction, painless bloody stool, same as angiodysplasia. So angiodysplasia and mucus diverticulum are painless bleed. Okay, so mucus diverticulum occurs after 6 months, whereas angiodysplasia occurs after 60 years. So IG mediated treatment, acute allergic test, urticaria, angiodysplasia and which